Okay, now this part of the lecture we're going to go over acid-base balance. In your book, it only talks about it for a little tiny bit, not a ton. It really kind of starts on page 267, and it kind of goes over sort of what acid-base disturbances are, and then it sort of ends on page 272. But it's a little bit confusing, so I wanted to explain it to you guys. And you've probably had acid-base before. I'm guessing you had it in physiology or pathophys or something like that. But what's really important as a nurse is to consider what acid-base balance your patient is in, what's causing the problem, and how do I fix it. Always, always figure out what's the problem and how do I fix it. I see a lot of students a lot of times just saying, let's assess. Well, we're going to assess that. Great, but after you've assessed it, then what? You got to move on. You got to move forward to move to the next thing, because you can assess somebody to death and then they're going to die because you never actually done anything. So let's talk a little bit about acid-base imbalances, acidosis and alkalosis. Okay, these are the three main things you need to know when you're doing your acid-base evaluation. The first thing that you're going to look at is your patient's pH level. Normal pH is 7.35 to 7.45, and what that is an evaluation of the amount of hydrogen in the bloodstream. So if you have a higher concentration of hydrogen, that becomes more acidic, and the pH levels go down. It's super confusing. So this way, if you're headed this way, anything less than 7.35 is considered acidic. Higher than 7.45 is considered more base. Down here has a higher concentration of hydrogen ions in the serum. This has a lower concentration of hydrogen in the serum. So I know that's confusing because lower hydrogens actually equal a higher pH, and higher hydrogens equal a lower pH. So what I would do if I were you guys is sort of ignore the hydrogen concentration if that's confusing you, because you don't really need it. The most important thing to remember is lower pHs is acidic, higher number pHs are base. That's really the crux of what you need to remember, okay? The next thing you need to look at is carbon dioxide. Carbon dioxide by itself is fairly acidic. Normal carbon dioxide levels are 35 to 45. So when you have higher than 45 carbon dioxide, now this is more acidic because there's more carbon dioxide, and carbon dioxide is acidic. When you have less carbon dioxide, this is more base. And we're going to go over some scenarios about why you might have one or the other. Bicarb is a basic element, hydrogen and carbonic acid, and normal range for bicarb is 22 to 26. So when you get higher than 26, that's more base, so this is going to make your patient more base. And when you get lower bicarbs, this is going to be more acidic. Okay? When your patient is more acidic, it's called acidosis. And when they're more base, it's called alkalosis. Step one, look at what your pH is doing. Okay, that's step one. And that's the very first thing that you have to do to figure out, is my patient in an acidic state or an alkaline state, or neither? Are they, if they're homeostasis, then yay, our job is done, our patient is healthy and they don't have an acid-base imbalance. But if it is less than 7.35, your patient is acidic. If it is greater than 7.45, your patient is alkalotic. Now you need to figure out, where's the problem? What is causing the problem? Because you need to understand what the problem is in order to be able to fix the problem. So that's when you start looking at your carbon dioxide and your bicarb. Carbon dioxide is predominantly a lung issue. Bicarb is predominantly a kidney issue. These are the two organs, your lungs and your kidneys, that regulate and determine your acid-base balance. So this is what you determine. So when you are given an acid-base problem, and the way that this is all arterial gas, you have to draw arterial gas. None of this works in the venous system. You got to regulate it from the arterial system. So when your patient gets an ABG, an arterial blood gas, that's when you determine this. You can't determine this from a venipuncture like we were talking about with the electrolyte things. This is all ABGs from the arterial side. Okay, so the step one, you're going to get your ABG results back, and you're going to look at this pH value, and you can determine, my patient's either acidotic or alkalotic. Boom, easy peasy. Here comes the tricky part, is figuring out which system is causing my problem. So then what you do is you have to go down and figure out which one is more out of whack. Because here's the cool thing about the acid-base system. Remember how I told you in the last lecture that your body is masterful at working together, and if there's a problem in one area, another area will compensate, because it's always trying to maintain homeostasis and equilibrium. In the acid-base system, your lungs and your kidneys work very close together to try to reestablish homeostasis. Okay, so you look at the carbon dioxide level and figure out, like, is it more out of whack? Okay, let's say my carbon dioxide level is 68. That's pretty high. That's pretty acid. Probably a problem. But then what will happen is, then because you're so acidic here, the kidneys will start picking up, I have way too many hydrogen ions in here, and so I need to start getting rid of some things, and so it will hold on to bicarb to increase the base, because it wants to restore this ratio. So if the kidneys perceive that there's too much acid, it'll start holding on to base. This process, the kidney process, takes a while. It usually takes anywhere between 12 and 48, 72 hours to compensate, but it will start compensating. Your lungs, on the other hand, so let's say that now I have I'm losing bicarb. This is a base. I'm losing this. Now my bicarb numbers are getting low. I'm down to 18 or 16 or something like that. So my bicarb is low. My lungs are going to pick up on that and say, oh, we better start retaining carbon dioxide. It's going to slow those respirations down, because it wants to hold on to carbon dioxide in order to increase the acidity so that you can restore the acid-base balance. The lungs can compensate for an imbalance very quickly. Within minutes, the lungs can start accommodating for some kind of an imbalance, especially in the kidneys. So that's it in a nutshell. Now I'm going to show you a couple little tricks. Okay, so if you're trying to, there's a couple little tricks you can do to figure out, because this, when you bring this down to real life, it gets a little bit tricky. Okay, there is this thing called Rome. And this is some trick that some people do. This stands for respiratory is opposite. I'll show you what that looks like. Metabolic is equal. Respiratory, remember, these are your lungs, and this is CO2. Metabolic is kidneys, and this is bicarb, HCO3 negative, okay? And what this means is, first thing you're going to look at is your pH. Okay, so if you have a respiratory problem, if your pH is low, meaning less than 7.35, so let's say this is 7.30, that's low. You give yourself a little down arrow, and then if your carbon dioxide is greater than 45, that's high. If your pH is, like now we're talking about a metabolic system, if your pH is less than 7.35 and it's a kidney problem, okay, so that's low. This would still be acidic. This would still be acidic. But then if your bicarb is high, which would be like higher than 26, no, I did that wrong. I did the opposite. If your bicarb is less than like 20, what's normal is 22, less than that, then this is low. That's less base. So this situation here would be, you could call it metabolic, and because it's coming from a metabolic problem, because both of your arrows are going in the same direction, it's metabolic acidosis. This situation is respiratory acidosis. So the easiest way to figure this out is, first of all, figure out, do you have acid or base? That's so super simple. If it's less than 7.35, it's acidosis. If it's greater than 7.45, it's alkalosis. Simple. So just write that down on your paper. It's some kind of either an acid or alkaline problem. And then if your arrows are opposite each other like this, so you just write down. So then you look at your carbon dioxide. Is my carbon dioxide higher than 45? Yep, you give yourself an up arrow. All of a sudden you've noticed that these two arrows are opposite, so you know that you have a lung problem. You've got a respiratory acidosis. Then if you look at your arrows, and this one's going down, but your bicarb is also going down, that is a metabolic problem. That's coming from the kidneys. So you have a metabolic acidosis. The same thing would be true, like let's say that this is 7.55, so that's high, so it's going to go like this. Okay, so now I have a base or an alkaline problem, and then if you look down at your bicarb and you find out that that's greater than, like let's say it's 28, now that one's also high. See how those are both going in the same direction? So now you have metabolic alkalosis. You see how I did that? Alkalosis. Because these two arrows are both going in the same direction. So that's one little trick to figure out, do I have an acid or a base problem? Now, the problem comes in when you're trying to figure out what do you have going on. Sometimes you don't know, because something will compensate for something else. So then and most of the time something compensates for something else. So it's really helpful to have a case study, but you don't always have a case study. Sometimes you have no idea what's going on. We're going to do a couple case studies first, just to kind of help you figure this out. So let's say I have a patient who has COPD. We're going to talk about this in a couple weeks. Chronic obstructive pulmonary disease. COPD is a combination of emphysema and chronic bronchitis. Patients who have COPD have distended alveoli and have a hard time getting carbon dioxide out, so they start retaining CO2. Okay? So, in your COPD patient, they retain CO2. So it's very common for them to have a CO2 that's greater than 45. So let's say that it is 68. Okay? So you have a patient who has a carbon dioxide of 68, knowing that carbon dioxide is acidic, and you have high acid levels. Chances are, what do you think this pH level is going to be like? High or low? Low. So a pH level in this patient is going to be less than 7.35 approximately. So let's give this guy, 7.28. Okay? So my ABGs come back and I have a pH of 7.28. So I know my patient is acidic. This is low. My carbon dioxide comes back at 68. That's high, very high. I can stop right there. See how my arrows are opposite? Respiratory opposite. So you can call this respiratory acidosis. Now, if your patient has had COPD for a long time, what do you think their bicarb is going to be doing? That's coming from the kidneys. If they've had it for a long time, which is a chronic disease, what do you think their bicarb is going to do? Knowing that their acid is high, the kidneys are going to want to hold base. So you're probably also going to have higher than normal base. So let's give this person a 30. This is respiratory acidosis with bicarb compensation. Kidneys are compensating. They're giving you a high base to accommodate the high acid. But your arrows are still opposite. Even if you didn't read this one, you just looked at, you've still got opposite, so you still know it's respiratory with metabolic compensation. All right, let's do another one. Now let's give our patient DKA, diabetic ketoacidosis. Kind of gives it away in the name. You should have figured that out. So this guy's pH in an acid is going to be also low. It's going to be less than 7.35. So that's going to be low. That's going to be acid. Okay, so let's give him, we'll give him a 7.25. Okay, now you look at the carbon dioxide. Now this person has diabetic ketoacidosis. So this is normal. I'm going to come back to this one in a second because I want to tell you something about this carbon dioxide. So then you're going to look at the bicarb, HCO3 negative. And again, your normal here is 22 to 26. So what do you think the bicarb is going to be doing? It's going to be low. Like this, because you're heading towards acid. So this is acid down here. This is more base. In a patient who has diabetic ketoacidosis, what else do you see is going on with that patient? That's very common. I'm sure maybe you guys haven't learned this yet. You know what? You might not have forgot. You might not have learned this yet. Your patients who are in DKA also have something that's called Kussmaul respirations. You might have learned about that in pathophysiology. Kussmaul respirations are very deep and very rapid. They'll go like that. Do you know why they might be doing that? They're breathing very deep and very fast Kussmaul respirations because what are they trying to do? They are trying to blow off CO2. They're trying very hard to get, because remember, CO2 is acidic, and they're trying to get less acidic in order to compensate for the high acid in the bicarb and the high acid in the pH, the high hydrogen levels. So Kussmaul respirations are a compensation. So if they've been in DKA for a while, you might see these CO2 levels, 28 to 30, something like that, because the patient's trying to blow off CO2 in order to help compensate the high acid levels, because when you blow off CO2, you're blowing off acid. So in this case, your patient is in metabolic acidosis. What is occurring here in your patient who has DKA is a very hypertonic situation. So here's our blood vessel again, okay? And you've got your regular stuff in there. You've got your potassium, you've got your sodium. Here's the problem. Okay, we'll give this person a little bit more potassium. And you got your red blood cells in here. Some of these are red blood cells. Here's the problem in DKA. Glucose, 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 glucose. Way too high glucose. Remember, you're supposed to have about 80 to 100, is recommended. Some people go up to 110. This is normal glucose, but in DKA, you can get glucoses, up in the 300 to 600 range. Way too much glucose. So your patient is in a hypertonic state and they are in metabolic acidosis. What do you do for this patient? He's already compensating. He's working very hard to do whatever he can to reduce the amount of acid. What are you going to do as the nurse to fix this person? So now you've assessed, you've identified, you've noticed the Kussmaul